Now I'll introduce Dr. Sheetal. Now she will be actually taking the next step, which is once you've established delight within your own team, how to ensure patient delight in a given practice. Over to you, Dr. Sheetal.
A very good evening, everybody. So I would like to thank AIOS and SharpSight for giving an opportunity to be here. I would be discussing about enhancing patient delight in clinical systems and processes. I must admit that this topic is very close to my heart because this is the motto of SharpSight. We don't believe in treating the patients, we actually believe in giving a patient delight. Patients are gods. Yes, you heard them right. Because they are the ones who earn us bread and butter, they are the ones who make us feel wanted, and they are the ones who make us what we are and we want to. So, how to help these gods enter in our clinic? What modalities to approach, that we'll be discussing now. So it all depends on a smooth and effective patient flow. So patient flow is nothing but the movement of patients within a healthcare facility. It not only involves a medical care, but also physical resources and internal systems for improving and maximizing patient load. Whether it is a small private practice or a big organizational practice, an efficient patient flow is the only key to increasing revenue and improving the efficiency. Experience, yes, it is the experience that ultimately matters. Whether you go to a restaurant or a hospital, the patient expects a good experience. Whenever a patient is walking into your clinic, you should be assured that he has already Googled about your hospital. So the experience of going to a doctor is no longer simply making an appointment, it is also a more of patient delight. So efforts should be made so as to make the journey of the patient in the hospital very smooth and enjoyable, so as to maximize the daily patient load. What are the guidelines that would ensure a good patient flow? Number one, clearly define the patient destinations. Whether you have a very big spacious facility, but make sure the patient should not get lost in your premises. There should be proper signages and color coding so as to guide patient for a smooth destination. Avoid bottlenecks. The small traditional check-in counters is the first area where the patient comes in contact with your hospital. So make it an enjoyable experience for the patient. Number three is minimize undue waiting. Always remember, nobody wants to sit unnecessarily. Whether you go to a restaurant or you come to a hospital, nobody wants to wait and sit unnecessarily. So try to minimize the waiting of the patient as much as possible. Ensure timely transitions among staff. That is, if your staff is under shifts, make sure the next person taking the charge should know why the patient is sitting in the hospital and what procedure he has to undergo. There should be a relevant waiting of the patient and not an unnecessary waiting. Parking. Yeah, it may sound a little humorous, but parking does affect your patient enjoyment and a patient flow. Smoothen out the elective surgical schedule of your doctor. If you are a high volume surgeon, try to keep your OPD and OT separately. Remember, both are important for us, OPD patients as well as the OT patients. So we have to give that delight to each and every patient that walks in. Use a patient flow software. This is one thing that has actually accelerated and given the patient delight. The integrated patient flow management provides a complete control over the patient flow from arrival till the discharge, and it also gives you a real-time data. Engage with secret shoppers. Who are the secret shoppers? It can be a friend, a relative, or a professionally hired person who can walk into your clinic, behave as a patient, have an overall experience, and ultimately report your shortcomings. So you should employ such people who can tell you your shortcomings also. Ask your staff about their opinions. Your staff is not only to work, your staff can also tell you things which you may not observe. Take feedbacks and reviews from the patient. This is very important. Ultimately, we are dealing with patient delight, so their opinion and reviews matter a lot. What are the systems that impact the patient flow management? First is manpower. Have sufficient people in your hospital, but their training and skill also matters. have a good infrastructure, a proper parking area, a spacious waiting area, and a proper space within the whole facility so as to handle the crowd also. You should be equipped with latest equipments as well as a state-of-the-art technology. What is the patient flow management at sharp-site eye hospitals, and what are the strategies we adopt to increase our clinical efficiency? Number one, valet parking. In all the centers of sharp-site, there is a proper valet parking so as the patient do not waste his time just parking their vehicles. So when that patient enters your clinic, he is more relaxed and stress-free. There are arrangements outside the hospital to take care of elderly patients, a ramp for wheelchair patients, and the lifts in the premises so that the patient can move easily and comfortably. We have easy appointment modules. There is a proper appointment schedule given on the website where the patient can directly book an appointment. Then we have a SharpSight app also. Through the app, everything is visible on the doctor's profile, his schedule, his timings, so the patient can take an online appointment also. The app of SharpSight is fully equipped. It can also have a live chat with the doctor as well as a complete information guide. For all our appointment patients, we make a rule that we ask patient to arrive 20 minutes early. This avoids chaos and illegible expectations of the patient, and he is more prepared for the waiting time. Always remember, the appointment time of the patient is the reporting time in the hospital, not the direct examination by the doctor. We have spacious receptions and check-in counters so as to accommodate more people at a time and reduce the waiting time. Keep patients busy in the waiting area. This is most important. A patient or the attendant sitting idle in the waiting area can create a lot of problems. So run educational videos on the TV so that the patient is busy. Number two, you can even motivate their attendants to have an eye examination. This will not only help them, but this will also help us. So this is the SharpSight's patient flow system, where the patient first comes in contact with the kiosk machine where the token is generated. The token is then displayed on the reception area so that the patient can know where his number is and what is the line where he is to follow. This is the home page, or the page which is visible on the doctor's screen. And I must tell you, it has everything to offer. It tells you what is the reporting time of the patient and whether the patient has an appointment or not, so that you can prioritize your patients. It also tells the waiting time so that the patient waiting unnecessarily in the OPD can be called early. It tells us whether the patient has gone for a counseling or any surgical procedure. It also tells you what are your number of surgeries during the day and what are your appointments. It also tells whether the patient is getting dilated or busy somewhere else. So it helps the doctor to have a complete control over the patient's status. It also has the bell icons and the reminders to tell you about the vulnerable patients so that you can give importance to them and see them early. So it helps the doctor to prioritize their patients so as to give them a good feel factor. So to conclude, effective patient flow is the only key to increase the revenue and improve the efficiency. Facilities, whether a small private practice or a big organization, that minimize undue waiting, that make destinations apparent, and that make transitions comfortable, result in a patient delight. Quality care and data accuracy in the form of EMR system enhances reliability among patients and hence increase the scope for new patients. Always remember, a happy patient can bring in 10 more happy patients. So every patient that walks into your clinic, it's your responsibility to give him the patient delight. So the next time you can get 10 more patients through that one single patient. So an efficient patient flow results in a happy patient and of course a happy doctor. Thank you.
This was a beautiful encapsulation by Dr. SHEETAL. I just want to bring out something very interesting. It is finally the patient or your client experience which decides the stickiness or the probability of the patient coming back to you, number one, and sending more patients to you. So one thing we must realize, that when we are in the trade or the business of eye care, You have to go beyond eye care. Most of us are so trained only to focus on what we are trained for in our medical schools or post-graduation programs. Nobody teaches us about the human connect, about listening to an old person. I have seen busy practitioners not even having an eye contact with the patient and just taking notes of what the patient is saying. They become machines. There is a very beautiful story by people, some people read about thinking protocols and magazines or literature which teaches about human mind. There is a very interesting story of a very famous cookie maker in France. She used to finish her cookies by 1 o'clock in the afternoon. They were so popular. People would queue for her cookies. So one of her interns said that I want to start on my own. So she laughed. She said, you can never make a cookie like me. Nevertheless, this junior opened a shop, a small shop down the lane. In 6 months, the junior had more cookie sales than her boss. So when the boss one day went there and she says, what are you doing different? She says, I'm making cookies as good or as bad as you are, but I'm giving my cookie clients a different experience. She would hand cookies with white satin gloves. She would offer one cookie as a taster. There would be people to usher people in. There would people be there to take the coat of the person if it's winter. That experience itself transformed her business. So I hope you understand what I'm saying. You and the practitioner next door will be doing the same surgery, giving the same results. What will differentiate you is the experience. You need to have a differentiator. Like any product. Even if you see thumbs up, they say taste the thunder. Any product will have a differentiator. So in our business, let us focus on patient delight and patient comfort. We all will do excellent surgeries, excellent diagnosis. So to be successful in clinical practice, especially private practice, you have to be compassionate and have to take care of the patient as a human being. So now we come to the next level. The next level is branding yourself in the market. So first you trained your team. Next, you made sure that your patient and the protocols in the clinic are good enough for the patient to have a successful and a comfortable